Hi, my name is Jonathan Hector. I'm the young age of 62 years, and I'm still here thanks to HeartFit. Coming from the heart, I would say they really know what they're doing. They're really concerned about you. They take care of you. It makes a difference. It's a lifesaver. Because you may think you're healthy, but really you're not. So you may think you're 100%, and if you have any symptoms at all, you should go to HeartFit because of with the staff there, with Diamond, and Deb, and all their staff there. They take such great care of you, and they're really concerned about your health. The best thing I experienced was knowing I'm going to be around for a few more years, because basically what they've done, the treatments they've done, and how they make you feel good, and they're very knowledgeable, and with what HeartFit does is helps you. My advice to them is don't rely on, which I did. I went for my blood work, and my cholesterol showed perfectly normal, and my blood work was in normal ranges, but I wasn't. And the difference of these tests here is it breaks it down. Your cholesterol particle sizes, your pulse scores, and all the tests they do goes that one step further. That can actually determine if you are at risk of stroke or heart attack. Where the old system is a guideline, and if you're within those guideline norm, if you're within those parameters, you're okay. They say you're okay. This is a lot more extensive. This is where the testing, what they do, really helps and can extend your life and God willing help you from getting a stroke, a heart attack, or complications from heart problems. The great thing is, besides losing more weight and doing an exercise routine, is I did what was really interesting to find out is they came out with the pulse test, which checks your additional markers on your stress that could be on your heart or possible to have an attack, and I was way off the charts. So what I mean by that is the normal for a man my age should be the score when the pulse test comes back should be 2.5 to 3.5. I was at 34.1, which means there was, as I call it, could be the silent killer. My arteries were clogging, which I felt good and didn't realize it was so bad. So basically, I was set up to start going on the bed and doing ECP therapy to help alleviate this. Well, it was amazing. I did the 35 sessions of ECP, and my pulse test. We did the pulse test again and the blood work, and the test results came back that I went from 34.1 to 8.7. Which was a pretty incredible change in that time frame. So 35 sites over the 7 weeks. I took time off, I exercised more, and with these changes here, and I feel like a new person. I've dropped probably over the last year over 50 pounds. I changed my eating habits. I changed my lifestyle. Well, I first initially at the old clinic went and did the consultation and did the initial blood work, and then Diamond measured my artery and everything like that, did all the testing to see what phase I was in and what the position I was in, or what my heart condition my heart was in there. And based on preliminary findings, it indicated I did have some problems, and I should take some additional steps besides what I already was doing, to do preventative. Basically, I saw my doctor first. I was having some problems, and he told me that I was borderline diabetic, and that I had to start to do some changes to my lifestyle, otherwise I was going to have problems. So I started losing weight, and then I was still kind of not feeling great, and I was driving down the road after leaving my doctor's, and I heard this ad on the Fan 960 about HeartFit Clinic, and I decided to call and check it out. I wanted to get because I felt like I was doing a lot of traveling, and with everything in my lifestyle, I just didn't feel good. I was exercising already. I was starting to lose weight, but I just didn't feel good. I felt like my heart was working harder. And I felt I better get things checked out. The problem I was trying to solve is to see if I actually had a problem with my heart, and that I was possibly at the risk of having a heart attack. Well, cardiologists, they're doctors, mm-hmm. And they have parameters they work within. So they have their tests and guidelines that they do. HeartFit kind of goes above and beyond that. And the cardiologist may recommend one test, but they have other tests here because a lot of them don't know about the pulse test yet, which is very, it's newer here, but it really makes a difference. So yes, cardiologists, that's their field. And, they may say, oh, you need a stent, or you need a bypass, or you need this. But really with the ECP bed and all the technology you're using here, you might have, pardon the pun, you might be able to bypass all that. And that makes a big difference. Because I'm doing testing now that I don't have to put that radioactive dye in me and do all those tests that they recommend because they use a guideline. And this goes above and beyond that.